Hello, my name's Dr Abigail and I'm a clinical psychologist. I've brought you this video today to talk about how to choose a good therapist, and I'm going to give you 10 points for how to choose a good therapist. Firstly, therapy is very different to friendship. When you see a therapist, it's not like you're seeing a friend, and it shouldn't feel like you're just having a chat with a mate. Therapy needs to be purposeful. It needs to be focused on an actual goal. Secondly, it's supposed to be one-sided. It needs to be all about you, the client, and not about the therapist. It's not right if they're telling you for 10 minutes about the difficulty they had getting to work this morning or other problems. Number 3 is evidence-based. So that means that they use the appropriate therapy where research says it actually works for your difficulty. So I'd be really careful of people that have a type of therapy that say it works with everything, because that's not really a truth. Some types of therapy can actually be ineffective or even harmful for certain problems. Number 4 is a therapeutic alliance. You need to have a rapport with your therapist. You need to feel that you like them and that they like you, and there's a comfortableness there. This is what we call a therapeutic alliance. You feel safe with them. So number 5 is that they take a history from you. A good therapist will want to know, well, what makes you tick? This will mean asking about your childhood, because a therapist can build up then a picture of really who you are right from birth all the way through. Number 6 is that the therapy actually creates dignity and value within you as a client. A therapy shouldn't be taking you down, shouldn't make you feel really small or really low. Ultimate aim is that as a therapist we help you feel that you have dignity and that we help you increase your value. Number 7, your personal experiences as a client, your inner world are valued. So that means that you don't feel that you have to make things bigger than they actually are to be listened to and to be believed, that actually your perspective is taken seriously. Number 8 is honest feedback. We're not perfect as therapists, and I know myself, I'm always willing to learn and want to know how I can do things better. And having a therapist that accepts honest feedback, you need to feel that you can give your therapist feedback and that they will change in accordance to that feedback. Another thing that's really important is the therapist isn't speaking to you in the evenings, or it's supposed to stay just within the session and maybe a couple of emails if it's to do with making other appointment times. The therapeutic work happens safely in the session. And finally, number 10, they are supporting you to make changes, that it's not just talking, that it's actually supporting you to do things differently in the world, to go towards independence. Because the idea of therapeutic relationship isn't something that's supposed to last for years and years and years. It's supposed to be a bit like a physio, educating somebody with a bad leg on how to walk differently and then how to go out and carry on without the physio ongoing. Promoting independence, it's promoting change, doing things differently, trying things out differently. Ultimately, the client can be their own therapist and they won't need to see us anymore. So those are 10 points. I hope this has been helpful for you. Please give me a thumbs up if you like this video, helps me know if I'm on track. If you'd like to know more about me, please see drabigail.co.uk.